Hi, my name's Ashley. This is my blood administration Passoff. So I'm going to go ahead and first start and look at the orders for my patient. I see that my patient has orders to get packed red blood cells today. It looks like we're going to go ahead and just make sure that their blood type has been cross-matched. They have. So it looks like they are A positive blood. They're compatible with an order for O negative. I see that they need medication, so we need to make sure we administer that 30 minutes before the blood is started. I see that the patient has provided consent, so we're going to go ahead and go to their room and just make sure they don't have any concerns and kind of just go from there. So we're going to go ahead and do some hand hygiene, knock on the door. Hi, my name's Ashley. I'm your nurse for today. How are you doing? Good, and can you just verify your name and date of birth? Thank you, I appreciate it, Darius. I do see Darius' son, that birth date matches. It looks like you're having some GI issues, and so we're going to go ahead and administer some blood for you today, is that right? Good, and I do see that you provided a consent, so we can go ahead and talk about, do you have any concerns? No? Okay. There are certain things that we're going to do to make sure we keep you safe during this transfusion. I want to go over some reactions with you just to make sure that you don't have an allergic reaction. We're going to look for swelling, shortness of breath, hard time breathing, a rash, hives, nausea, or vomiting, okay? We're going to monitor you through this whole procedure. We'll be here making sure that you stay safe. If you have any concerns at any time, you let us know, okay? Perfect. Before we can begin, I've got to go ahead and do some vitals on you. So I do a baseline assessment. We're going to make sure that we listen to you as well. So let me grab my stethoscope here. We'll go ahead and just take a listen. Okay. We're going to make sure we listen to all the parts of the lungs. We're assessing for any fluid buildup. Thank you, and can you go ahead and lean forward and I'll listen to your back? Perfect, thank you so much. Okay, you sound great. I don't see any signs of swelling or edema on your extremities as well. Everything is looking good there. So now I'm going to go ahead and just get everything set up for that transfusion. From the time that we pick up the blood from the bank, we want to make sure we get it started within 30 minutes. So I'll go ahead and get that. We'll get you set up and we'll get that going. So I'll be right back. So now we're going to go over to the blood bank. Here we are, we're picking up our blood. It looks like our patient A positive matches, the blood is O negative, that matches, his name, Darius' son, his date of birth, expiration date. We're going to inspect the bag. We'll also inspect it in the patient's room, make sure that there's no signs of gas, color, odor, everything looks normal there. So we're going to go back to the patient's room, knock knock. Hey Darius, it's Ashley again, hygiene. We're going to go ahead and get you set up here for this procedure. So before we can begin, I've got to verify that this blood is correct for you. So I'm going to invite one of my friends, she's a nurse here as well, and she's going to go ahead and verify this with me. So we've got Darius Hassan, birthday 8/10/57.
8/10/57.
And he's A positive.
A positive.
O negative is the donor.
O negative.
And we've got 0094149.
Perfect.
And the expiration on here is 1/30/26.
Okay.
And that is all matching. It looks good to go. I've already inspected the bag. It doesn't look like there's any signs that it could be infected or anything like that. So now I'm going to go ahead and get this all set up for you, Darius. So I'm going to put some gloves on. you're doing your assessment, you should also check the IV. You're going to want to make sure that it flushes. I'm going to do that now before I get my tubing hooked up, just to make sure everything is all good to go. So I'm checking the IV site, no swelling. I'm also going to check for jugular vein distension as well. Make sure covering all the bases. You need to make sure that you clean the port here for 30 seconds. 30 seconds. And then you're just going to want to make sure that it flushes well. Maybe. What is going on? Okay. I think my piece that is supposed to connect to this is not here. Okay, it's probably on the old tubing. So normally you would have a little adapter that you could just put right on. And so pretend this is clean and this is brand new. Okay, so that's what I would alcohol. What is going on? Okay. Can we pause the video and grab stuff really quick? Well, you keep that going. Hey.
Hi.
You're on camera.
Oh, that's okay.
So I think the piece that's connected for the IV so you can flush it came off with someone's kit.
It sure did. We are just gonna, let me just steal from this one, okay? There we go.
Okay, thank you.
You're welcome, sorry about that.
Thanks.
Hi, Natalie.
Okay, so this would have been alcoholed. It's clean. Now we're gonna flush. Oh, that's flushing beautifully. Okay. Alright. Okay, so there's that. So now I can go ahead and get my tubing set up. We're gonna go ahead and get our tubing, make sure that you don't like get this thing hitting on anything. You're gonna get your saline first. Going to a little bit tangled, so we're gonna make sure that we don't have any knots in our line or anything. Okay. And then we want to go ahead and fill the filter. This part needs to be filled. We're just going to make sure that it's above that filter so we don't destroy the blood. That looks good. Okay. And then we're going to go ahead and get this connected. We need an alcohol swab to clean the port. Seconds, you'd clean that. Okay. And then you just want to make sure that that goes through. Looks good. Okay, so now you can go ahead and set up your blood. Again, you want to do this within 30 minutes from the time you get it from your blood bank. You want to make sure you give the whole transfusion within 4 hours. You're going to start it slow with 2 milliliters. And then after 15 minutes, if there's not a reaction, you can go ahead and increase the speed of the transfusion so you get it done within the 4 hours. So you go ahead and start your bag. Get it all the way to your patient. And then once it's at your patient, you slow it down. Okay. So now I can go ahead and just slow it to a drop. And then you want to make sure that you have your saline above that again, just to be sure. Okay, so that's slow. I would watch it for 15 minutes. I'm gonna go ahead and do another assessment of vitals, do baseline vitals on them. Have you had any nausea, vomiting, chills, anything like that? No, I don't see that you have a fever. Everything is looking good. So we go ahead and increase the speed of the infusion now. We go ahead and get that infused into our patient. Okay, the time is finished, so I go ahead and stop my blood. It's important to note that if there was a sign of an infusion reaction, we go ahead and stop immediately. Disconnect the blood, stop the infusion, disconnect the line, put it in a red blood bag, get it back to the blood bank, and you'd notify your provider as well. You'd put a normal saline bag on with new tubing and get that flushing through as well for the patient. So we can go ahead and just flush out this line with saline. And once that's flushed, we're gonna go ahead and just dispose of it in a red biohazard bag. Okay, so we're gonna see that this line is now clear. Go ahead and just stop everything. Okay. We can go ahead and disconnect our bags. So now that this is all done, after I dispose of this bag, I'm going to go ahead and do another baseline assessment on my patient. I want to make sure that I listen to their lungs again, so I'll just do that in a second. Make sure everything is disposed of appropriately. This would go in your hospital's designated place to your biographic bag. Hand hygiene. And then I'm gonna go ahead and just listen to you, Darius. So we just wanna compare this to our first listening, just to make sure that there's no, new issues or anything like that that we're hearing. Everything's sounding good. Let's listen to your back. Okay. Everything sounds normal. It sounds just like before we started the infusion. Again, we're assessing, make sure you're not having a reaction, no hives, nausea, vomiting, anything like that. I don't see any edema. There could be a delayed reaction, which is something that we need to watch for, so please let us know if any of those things do start to happen. Just call the nurse. I'll give you your call right here, so you can call us. I'm gonna go ahead and get this documented that we performed this blood administration for you today. Do you have any other questions for me? No? Perfect. Okay. Thank you.